I've had a lot of patients recently ask me, what do I say when I go to my endocrinologist? What questions do I need to be asking? And there's one question that I would ask, and that is, what are their goals for you? So it can get a little bit confusing, but an endocrinologist is typically trained to give you medication. And one way you can tell what those goals are is when they run those tests, how many tests are they doing and how in depth are they really looking at what the actual underlying cause is. It's not that they're bad people, but their goal is typically to get TSH and T4, maybe free T4, and give you a medication or a combination of medications to get that into a normal range. And if it's medically within that normal range, then they say that you're good. Unfortunately, in my experience, what I have found is I have a ton of patients that come to me saying they've been on medications for years, sometimes even decades, and they feel awful, and they keep going to their doctor, their endocrinologist, and saying, I feel awful, but those numbers are still within the normal range, so they say that's all that they can do for you. Sometimes they even tell you it's just in your head. So if your goal is to correct the underlying problem, then oftentimes a functional medicine doctor like myself, or somebody who is trained and specialized in looking to the root of the cause or finding the underlying cause, that is where you're going to do comprehensive testing, oftentimes looking at the gut, a very comprehensive test looking at the thyroid, including numbers like reverse T3, TPO antibodies, TG antibodies, free T4, free T3. It's so important to know if it's more of an autoimmune issue or if there's conversion issue. Again, we look deep into what the liver is doing, the amount of inflammation in the body, what that immune system is doing. And in doing so, if your goal is to correct the underlying problem and build so much health in the body that oftentimes there's very little need for as much medication as you're on, and sometimes even no medication at all. I never tell my patients to go off medication without the supervision of the doctor who provided it. But what I have often seen, I mean, many times I have seen it where on the retest, we have a patient whose numbers were out of balance when they started on the medication. We build so much health into the body that when we do a retest, it's out of balance. So they bring that test back to their provider and say, now it looks like I'm actually over medicated because my body's starting to heal. And that is our goal. So if that's a goal for you, I encourage you to reach out to our office. You can check out our website at drstanschulte.com. But I'd love to help you if your goal is to really correct that underlying problem. Hope that helps.